Good morning, Bellingham. Today is Wednesday, April 22nd. Cindy McNulty here from your Board of Selectmen, offering our daily update for the town of Bellingham and everything related to the COVID-19 pandemic. I'm going to turn it over to Deputy Chief Mark to give us some updates on what the numbers look like.
Great. Thank you very much. Thank you all for joining us. Massachusetts numbers, 41,199 cases with 1,961 deaths recorded yesterday. In the U.S., 819,175 cases with 45,343 deaths and 82,973 recovered, which is a pretty good number. So let's keep those recoveries going.
That's the number we want to keep.
That's what I want to see keep going up. Yes.
Speaking of numbers going up, I'm going to turn it over to Esther for an update on what's happening in Bellingham, please.
Good morning. So far, we have had a total of 198 residents tested with 59 confirmed cases. 34 of those are current and 23 have recovered with 2 deaths.
Okay, thank you, Esther. Bruce, how about from the Board of Health?
The Board of Health met last night. My board is looking into generating a mandated mask in the workplace, or possibly a total mandate mask townwide if you're out in public. I'm working with a couple of the other local boards to come up with something so that we're very similar with like Guilford, Medway, surrounding towns. And it may turn out that the governor turns around and does it ahead of us anyhow. But anyway, if you do go out, please consider wearing a mask or a bandana. Keep you safe and those around you safe. Wash your hands frequently. Try to maintain that social distance. It gets difficult in the stores, but when you get in there, pay attention to the signage and the tape that's on the floor. Try to maintain as much distance as you can. Be aware of the person around you. If he's too close, maybe you want to move or something. But we got to get through this. The number's still climbing. We haven't quite reached the peak yet, so we want to keep that in mind. Go out only if you need to.
Bruce, what are you thinking is in terms of timing for the mandate for the mask? Is it like within the next day or two?
Yeah, the next day or two. I'm going to see. Milford did do that. It was on social media yesterday. So I was going to reach out my counterpart to Jackie over there and see what they did, what they have written, and try to piggyback off of that.
So the word would probably go out how, through like Facebook or email?
Probably as quick as possible.
For people to be on the lookout.
We'll definitely let them know during our
for
show.
all those folks that tune into this show, yes, you can get your news.
I mean, it's all for the protection of you and everybody around you.
Great. Thanks, Bruce. All right, today we have 3 guests to join us. We're going to start with the superintendent of schools, Peter Morano. Peter, if you can give us an update on what's happening in the schools, please.
Sure, absolutely. Good morning, everyone. So yesterday, the governor ordered that all schools remain closed till the end of the school year. For us, that means our last day is June 18th. We got some guidance from the Department of Ed that will help us update our remote learning plans. So our students will continue with those remote learning plans. They're going to provide us with a little bit more information on what standards they want us to cover during that time. And I have to say our staff and our kids are doing, and our parents too, are doing a tremendous job keeping up with all the assignments and the work around the remote learning plan. So I'm really pleased with the progress that everyone's been making, and deciding to have some school this week, typically being April break, I think was the right decision as it kept the momentum going, and kids have really responded well. So that's been a real positive for us. 2 things we are focusing on now that we have the information about closure. One is, and this is, really just a terrible year, not just for all of our students, but particularly for our seniors. This should be a year where they're excited and getting ready for college and, going through all the activities that they typically do during senior year. And this group obviously won't have that opportunity. So we're looking at defining or determining what their last day will be, because typically they end before the rest of the school children. Also figuring out how we can do some type of graduation ceremony for them. And then we need to look at activities. My guess is we definitely won't be able to have prom. That was scheduled for May 14th. but we'll have to look at other options going down the road. The other issue that we're looking at is I know a lot of parents have reached out about picking up materials that are things that kids have in their lockers. So we have to figure out how we can do that safely down the road. That probably be something for June. I know a lot of our kids have their stuff in their lockers. Seniors specifically, they need to grab their materials. So we're working on a plan to make that happen. And lastly, tomorrow I'm doing 2 Zoom meetings for parents where I'll talk about some of these issues that we're looking at right now. Pre-K to grade 5, that's going to happen between 5 and 6 p.m. And then grade 6 through grade 12, their Zoom meeting is from 6 to 7 p.m. And I just sent out a message to all families.
Excellent. Thank you so much, Peter, for that update. Next, I'm going to turn it over to Jocelyn Cochran from the Relief Center in Bellingham. Jocelyn, what have you guys been up to?
Hello. So we limited our hours from, usually we're open from 10 to 7. We limited them down just to 11 to 6, just to kind of keep everybody safe and, not have so much time available for people. We offered curbside pickup, so that's something new that we just started doing a couple weeks ago. People can just call in. If they already know what they want, they can just let us know and then tell us when we get there, and then we can take their payment over the phone and run it out to them when they get there. And we also have, what?
I didn't mean to interrupt. Sorry. Go ahead.
We also have a website. It's mycbdreliefcenter.com. And then I would just ship it out. So we try to make it as easy as possible. I have let one person in at a time if they have a lot of questions. If they're masked, I'm masked too. So we're trying to just keep it as simple as possible. I have Lysol wipes right by the door, so every time somebody leaves, they just wipe everything down. But yeah, that's basically it. We're just trying to keep, the contact between people as limited as possible.
Perfect. Just so you know, you got a big thumbs up from the Board of Health on your protocol. So congratulations.
I didn't say the phone number, but if people need to find it, you can find us on Facebook at Relief Center. But the phone number is 774-460-6084. But yeah, we're trying to do everything to keep everybody healthy because, it's getting a little bit crazy out there.
I know you have had a big rush on hand sanitizer, I saw.
Yeah, we have. Yep, we've got hand sanitizer. We're actually getting more at the end of the week. We have some that's CBD infused, so people like that one too because it's a natural antibacterial, antiviral in itself. So adding it to the hand sanitizer, people like that part.
Perfect. All right. Thank you very much. All right. Our last guest for today is Chris Lanou from ADC Septic. Chris, what's been happening in your world?
Hey, good morning. Thanks for having me on. Things have gotten crazy. Luckily, us being essential, we've been extremely busy. There's been some changes that we've had to implement. Majority of the septic that we haul goes into Uxbridge Wastewater Treatment Plant along with Milford. Uxbridge was our primary dumping area. They restricted our limit to emergencies only. So that put a big check in our operation. So what we ended up doing was we have them going to Milford. We also purchased storage containers that we're having trucked down to Southern Mass so we can keep going. With everybody being home, what we're finding is a lot of clogs. Toilet paper, for some reason, is the hottest commodity, and it's in every house we go. We're having clogs in pipes and everything. All the kids are home. Everybody's flushing everything, especially baby wipes, which should not be flushed in any system. So we're getting a lot of calls. And what the Uxbridge did by shutting us down, emergencies only, the problem with that is at this time of the season, with everybody being home, this is when systems need to be pumped because most of the people are at work during the day using facilities. The children are at school using facilities. So during the day, your systems aren't getting used. Now everybody's home all day. Laundry's getting done, dishes, everything. The systems are getting a lot more use than what they normally do. We have systems that, 2 years ago were perfectly fine, and now they're in failure because of the amount of water that they're taking. So we're still running 24/7, helping out whoever we can. we kept our rates steady. Even though it's costing us more to dispose of the septic, we're still keeping our rates the same. The other thing that we have, big increase was portable toilets and hand wash stations. We just had an order of units come in. All the ones with hand wash stations already went out. There is a national back order of hand sanitizer. So we can't get those anywhere in the country for the bulk that we use for all our dispensers and our toilets. So what we ended up doing was just today we had an order of 100 dispensers, and now we have to buy 55-gallon drums of hand sanitizer that a company's making in North Carolina. So we're going over to that. It's a big expense, but the units need them. So we're going to be offering that, and there's no additional charge to anybody. We're keeping our rates the same.
Hey, Chris, Don DiMartino was on earlier on the show here, and if you could elaborate a little more on the trouble that the wipes are creating for you and, you know, what you foresee. I know even if there's a town sewer, that the wipes are getting in and causing trouble down at the treatment plant, but if you could expand on it a little bit.
Absolutely. The wipes, they all say flushable. They're not. Meaning when they put flushable on those containers, what it means is it will flush down your pipes and it will go to its final destination. What happens with those, they do not break down. Toilet paper is designed to break down when it hits water. Those wipes actually they get stronger. And then you have grease, you have powdered detergents that get into septic systems and sewer systems. They'll actually coagulate with the wipes. They just get stronger and they ball up. You have a lot of pipes that leave the foundation to a septic tank. They're not perfectly straight or they're pitched. So they could have a belly in them. Those things will all sit there, and that's where all the clogs are coming from. When we go and pump these out of the tank, one, it clogs up our hoses, gets into our trucks, gets all over the baffles inside the trucks. And when we go and dump them at the sewer station, they have pumps there, grinder pumps. You would think that, okay, the grinder pumps are going to dispose of these. No, they don't work that way. They're so flexible and pliable that when the grinder pumps are working, they'll actually wrap around the cutter heads. And then as they wrap around the cutter heads, other ones stick to them, and then they have to shut down the pumps and they got to clean the cutter heads. For example, town of Blackstone, we've been called out numerous times. Their pumps, the ejector pumps, the wipes will get up in the bottom of those, and once they get in there, they jam up the entire pump. They can't grind them, and then they got to pull a pump out. We have to pump the ejector station while they're doing that so they can clear the pump. So wipes are the things that should not be flushed. We educate everybody when we go out, and if we see wipes, do not flush them. We give them pamphlets and try to eliminate this from happening with our customers. And people on city sewer systems don't realize it. They're flushing everything, but this does have an effect, especially when it gets to the wastewater treatment plant. They have the same issues. They have the same pumps.
See, I think there's a huge misunderstanding. What's the word?
Understanding.
Misunderstanding.
Good understanding.
Misunderstanding that because it says it's flushable, that they actually are. And I think we need to get that word out. I've
Yeah.
seen a couple of posts, actually as recently as this morning, where somebody went in and said there is no such thing as flushable wipes. So I'm glad to hear the clarification, but I wonder if there's an opportunity to get the word out in a bigger scale versus when there's a problem and Chris is called in.
Right.
Yeah, so there's a lot of advertisement going on around there about not flushing. I mean, we do Facebook ads all the time with not flushing wipes. You can go to our Facebook page, our website, everything's on there. Like I said, we educate every customer we go out to. We hand out a pamphlet stating what can and cannot be flushed. So we're hoping that, over time, people will get it. And there is actually, I believe, a lawsuit against the manufacturers of wipes to change their labeling on the bottles to get rid of the flushable. So I know that was a class action lawsuit that was happening.
I'm wondering if maybe one of our next code reds, we have Don on and just make the statement, because I again,
We've
think it's
We've already done it recently.
I think it's worth doing it again.
Yeah. We can get the word out again.
People believe what they see. If it says on the container that they're flushable, that's what they're thinking, right? I mean, I just learned a whole lot about what happens on the other end of that, which is not pretty. So
There's one other thing I wanted to throw out there. Along with my company, just a public, whoever's watching, we also have a nonprofit organization called the ADC Initiative. Back in 2014, my wife passed away of colon cancer. So I started a nonprofit in her name. So what we do is a percentage of my company and every job goes into this nonprofit. And then if anybody in our service area has, we advertise on our Facebook all the time. Right now, I just put it out there. If people are having a hard time with, paying for food, electric bills, stuff like that, and if they qualify, I'll help them cover those bills as much as I can. We just had a person in Whitensville today I just paid off her electric bill. So we're doing everything we can to help out. So if anybody's out there, go to the ADC Septic Facebook page and the ADC Initiative Facebook page and the websites. And all the information's there. There's check forms. Like I said, we're doing everything we can. We're also offering free pumpings for elderly or sick people that can't afford them, that are having problems. So we're trying to give back to the community as best we can, because we are very, very fortunate on my end that we are working, excavating, and we're still able to produce some work. Sorry about that.
That is very kind of you, Chris. Thank you very much for that. We'll make sure we give you some exposure on our local website as well. Thank you.
All right, thank you.
All right, the next part of our program is some questions that I am going to read. I believe they're both, well, one is for you, Esther, our public health nurse. It reads like this. I would like to help my daughter and son-in-law with their kids so they can work from home. I am 67 and in good health. I have not gone to a store or anywhere with people except to walk each day in my neighborhood. The kids have been isolated in their home without contact from anyone but their parents. One parent does the food shopping. Do you think it'd be okay for me to help out in their house, but keep social distancing within a large room to help keep the kids occupied during work hours?
That's a really tough question. You know, it's not advised that you visit people that you don't live with, but I understand that you want to help your family. If everyone has not had any symptoms and everyone has maintained their social isolation and their social distancing, it would be okay to visit for a short time not in an enclosed area, and as long as you're wearing a mask. You really don't want to transmit any of the virus or potentially transmit any of the virus. It's really not advised, though, that you be in an enclosed space less than 6 feet with people that you don't live with.
In time frame, is there a magic number of, I know you said, I know to be exposed, it's more than 15 minutes, right? But in
That's
this
correct.
particular
And
case, sorry.
I'm sorry?
If she is, what she's describing, it sounds like social distancing with a mask. Is there an amount of time that you think is safe, or?
There's really no time limit on that. I mean, as long as you're social distancing and in a large area, then there's really no time limit, as long as you're wearing a mask and practicing good hand washing and keeping all of the other social distancing in place. I mean, it's much like one of us going into an office setting, wearing a mask, keeping the social distancing. It's very similar to that.
Okay, great. All right, thanks, Esther.
Yep.
The last was a recommendation. It said we're being asked to add in an update on the active and recovered number of cases, as well as the cumulative number. Mary, I'm not sure if you can zoom in on the sheet that shows. So to get to that number, really all you need to do is take the number of positive cases, which for today is 59, subtract the number of recovered, which is 23, and then you have the number of active. We're just trying to keep all of our data points on a small sheet of paper. So that's really how the math is involved to get to those numbers. Larry, do you have anything to add? Bruce, you good?
I'm good.
I'll just finish out with my usual. If you have any COVID-19 questions, you can dial 211, and that'll get you any answers you're looking for. Also, if you're having any problems at work with some payroll or anything like that, you can call 617-727-3465, and that's the Massachusetts Attorney General.
Perfect. And we also have the email address for Bellingham residents, which is covid19@bellinghamma.org. Those are the source of the questions I just read. So please keep them coming, and we'll make sure we get you the answers. And other than that, we'll look forward to seeing you back again tomorrow, same bat channel, 10 o'clock. Stay safe. And
Thank
please
you.
Remember, say it, for God's sakes.
For God's sakes, wash your hands.
All right, take care. Have a great day.